Hello, so I'm starting about GIT pharmacology. This video is for revision purpose only. In GIT pharmacology, mainly we will talk about the peptic ulcer disease pharma and other ulcer coating drugs and other drugs for eradicating the H. pylori and etc. And about the anti-diarrheal drugs and the anti-emetic drugs, means the drug of the diarrhea and the vomiting, we will gonna talk about in another video. Otherwise this video will become so huge, so it will not be like good. Okay, so let's begin. So for GIT we will first talk about the PUD. We know it is peptic ulcer disease. That simply means the ulcer in the stomach or the duodenum. Okay, so ulcer is kind of a erosion, circular erosion in the lining of the stomach or the duodenum. Okay, so which drugs we will use? So basically we will use certain drugs, like for example to decrease the acid secretion, because it might be possible that the acid is so much inside the stomach and due to that there is ulcer. So for decreasing the acid secretion we use certain drugs like proton pump inhibitor, the drugs in which in their name there is prazole, then H2 inhibitors, in the like in drug names there will be tidine, then another one is M1 inhibitors like zepine, sorry, I mean. So another drug is for increasing the mucus secretion like misoprostol or like enoprostil or like rioprostil. So these drugs, prostil, these are basically the for increasing the mucus secretion. Then another drug for like neutralizing acid. So like there is acid and too much acid, so we can neutralize also that acid by like antacids. Okay, for example by sodium carbonate, like okay, then by other drugs like for example aluminium, for example aluminium hydroxide, and another one like etc. Okay, so like for example calcium carbonate also. So they are like these drugs, but not of much important use. Then mainly is sodium biocarbonate, we should focus on that. Okay, now another one is the drug for the eradication of the H. pylori, and basically we use the triple regimen in which it includes like metronidazole, and with metronidazole we can use clarithromycin, but if metronidazole is not available we can use amoxicillin also. Okay, then there is another drug like for example lesnoprazole, or we can instead of that we can use like vonoprazone also, and like omeprazole also, anyone. Okay, so and we use generally bismuth also. Okay, now there are ulcer coating drugs, for example sucralfate, and bismuth. Okay, so these we can use. So basically the proton pump inhibitors, they are the drugs which consist of prazole in their name. So like for example here is like omeprazole. Okay, or here there can be like lansoprazole. Okay, or there can be like tenatoprazole. This tenatoprazole is long acting, we should remember that. And another thing is that these proton pump inhibitor, they are the drug of choice for the peptic ulcer like disease. Reason can be anything, for example either any like peptic ulcer disease because of either H. pylori or because of other like another cause. So any cause, the drug of choice will be proton pump inhibitor, that means the prazole drugs. Okay, and in case of like ZES, okay, this Zollinger-Ellison syndrome, in that case, and in case of GERD also we can use this proton pump inhibitor. This is the drug of choice. Okay, then comes the lansoprazole. Basically this lansoprazole, it is the most potent, like most potent, okay, most potent as well as the safest in pregnancy. Yeah, this lansoprazole is most potent and safest in pregnancy. Okay, then comes another drug, that is the rabeprazole is fastest. Okay, so rabeprazole is fastest, plus it has least drug interaction, it has very least drug interaction. Okay, and another thing is that it's decrease the activity of the clopidogrel, this rabeprazole, so never to be given together. Then there can be certain side effect of these proton pump inhibitor, like for example the patient can get anemia, for example due to decrease in the absorption of the iron, or there can be infections, or there can be other like diarrhea, abdominal pain, and so much more. Okay, but not that much important for our syllabus. Then another one, there can be other drugs like for example reveprazan. Okay, So these drugs can also be used, or other drugs like for example we have talked about that H2 inhibitors, that is the drug consists of tidine in it. Okay, so for example the H2 inhibitors like tidine in it, that is for example cimetidine. Yeah, cimetidine, either cimetidine or ranitidine. So these drug can be used. Okay, another thing is that in among the tidines, the famotidine is the most potent. We have to remember that famotidine is the most potent. Okay, then comes the antacids. So if you talk about the antacids, what exactly these antacids? So these antacids are nothing but these are weak bases. Okay, these are what? These are weak bases. Okay, so we have to reduce acids. Okay, so we have to neutralize the acid by the bases. So antacids are what? These are the weak bases. Okay, in antacids we can say the major role of antacid in is in what? It basically for ulcer pain. Yeah, the patient is in so painful condition, so we should use antacid. Okay, first or we can say when the patient can't tolerate the pain, so better to use antacids. Okay, and then one thing is that antacids they decrease the absorption. They decrease absorption, like for example of certain drugs. And specifically if we talk about that the drug can be acidic drug. Okay, like acidic drug, for example tetracycline. Yeah, tetracycline, so it decreases the absorption of tetracycline, so better to avoid while the patient is on tetracycline due to some other conditions. Then another one is like simethicone. So this one, right? Simethicone. This simethicone is basically an anti-flatulence, means for the fart. Okay, for stopping the fart, this drug can be used. Okay, then another drug can be aluminium hydroxide, which I have told you earlier. Okay, that is, this one is important one. These mainly aluminium hydroxide and the calcium carbonate is important. Okay, so basically this one like aluminium hydroxide. Okay, aluminium hydroxide cause constipation, we know that. Okay, plus with that the magnesium salt that can cause the diarrhea. So one is causing constipation, another is causing diarrhea. That's why we use it together, so that it can cancel out either each other side effect. Okay, another gastroprotective agents like for example we can say for most specific, for example most specific, yeah, most specific drug for prevention as well as the treatment of the NSAID induced ulcer. Yeah, the person who are taking NSAID, or patient who are taking NSAID, they can get ulcer also, you know. So for prevention and for the treatment we can use most specific drug, that is the misoprostol. Yeah, we can use misoprostol. And certain like other drugs can be used. For example we can use like ulcer coating drugs. Yeah, we can use ulcer coating drugs, like for example saccharofate. Yeah, we can use that. Okay, or colloidal bismuth can also be used. That another thing for bismuth is that the bismuth is basically have an extra effect, we can say this medicine bismuth can act as an anti-H. pylori drug also, but there is a side effect. The side effect can be that it will be doing the blackening of tongue. So that is a drawback of the bismuth. So that's all for today.